for being here. You know, Infirmary Health has been the lead in so many different ways in the healthcare business, and COVID is nothing different. We want to take this opportunity to update you on where we're at as an organization and give you the opportunity to ask some questions. But before we do any of that, we personally would like Taylor Morgan to come up here and give a prayer.
Let us pray. Dear Lord, we just ask for your presence to be with us in this difficult time. We ask that you be with our patients who are coping with COVID-19 and with their families. This is a scary time for them. May they know of your comfort upon them and of your presence. And Lord, we ask that you be with our physicians, be with our nurses, be with all of our medical staff that are working with these patients at this time. May they know of your comfort and of your strength because they need it. And just continue to be with our leaders. I know this is a stressful time for them as well, making decisions, important decisions on behalf of Infirmary Health. May they know that you're walking with them and give them strength as well. Amen.
Good morning, everyone. I'm Mark Nix, President and CEO of Infirmary Health System. Thank you all for coming on such short notice. Taylor, thank you for the prayer. We all need it. A lot of people in our community need it. And the reason we're here today is to not only to create some awareness about the current situation we're in, which is at a crisis level in our communities right now, but all along the Gulf Coast in particular, but also to thank our healthcare workers, not only our healthcare workers across our city, of all organizations, but across our state and across our nation. But in particular, I want to thank the healthcare team here, the Infirmary Health team, for what they have done, because today we are at the third time since the pandemic's has occurred and been declared that Infirmary Health System is the leading caregiver across the state of Alabama for the number of inpatient COVID patients. This happened in July of last year when we first saw the wave of the pandemic come along the I-10 corridor from New Orleans. It happened again in January when we had a crisis with a number of deaths of our elderly and our nursing home patients, and it's happening again today as Infirmary Health now has over 300, and we have had for a couple of days, over 300 inpatient COVID patients in our 3 acute care hospitals. Now, Mobile Infirmary has been the leader in care across the nation. A couple of times UAB or Huntsville have treated more people, but we probably have more experience because our physicians have seen more, our team members have seen more, but that's starting to put a stress on our team members and our physicians. And we need your prayers for them, and we need your recognition for them. When we first had this crisis came out, there was a lot of support for our team members, a lot of support for our physicians and our nurses and all of our caregivers. And people were doing, vigils in the parking lot and prayer vigils and food recognition and gifts to our employees. The third wave around, everybody has COVID fatigue, and they are no exception. They have COVID fatigue as well. And it's time for us to start thinking about them again, recognizing them, and understanding the stress that they're under. Today, we have over 160 employees of our own team members that are out with COVID. We have over 650 open positions because the number of people that have retired or they've gotten fatigue of working COVID or working 12-hour shifts, taking care of other people in our community. So today, of all of those people that are in the hospital, the vast majority of them are unvaccinated. So this is also not only awareness, but it is an appeal to those of you that have not been vaccinated to please reconsider it, because it is not just about you and your families and your employees. The stress on the healthcare system today is starting to limit our capability of doing other things that we were doing before the pandemic was declared. The EMS response times are slower because there is very, very difficult to get patients in the hospitals, and we're going to hear from our hospital presidents. So please consider the vaccination. Please do us a favor and thank a healthcare worker, thank a physician for all that they're doing to try to save our community's health and get us beyond this pandemic so that we can move forward. So now I'd like to introduce Susan Boudreau. Susan is the president of Mobile Infirmary, and she's going to give you a little update on specifics at the hospital itself. And later on, we're going to take questions at the end of the announcements.
Good morning, everyone. Thanks so much for taking the time to be here and help us get our message out to the community because it's so very much needed. I mentioned just a minute ago to the mayor that I remember being in this very same spot in early December, and that's when our vaccinations hit. And we're at that point, the emotion in December is very different than it is today. In December, we were thrilled because it was the first time that we had something to help our patients fight this terrible, terrible disease. And so we thought it was like manna from heaven. Finally, we have some help that's arrived to help our community. Well, today, we're in worse shape than we've ever been. We are suffering our fourth surge of COVID inpatients at our hospital at Mobile Infirmary. We carry, on average, around 500 patients every day at the hospital. Mobile Infirmary is the largest non-governmental hospital in the state. As Mark mentioned, we've been leaders in the state during this entire pandemic because we have a lot of capacity and we have a lot of people, and we're here to serve our community, and that's what we do, and we're happy to do it. So just to give you an idea of how it's impacted our hospital so quickly, on July the 1st, we had 8 COVID inpatients in our hospital, and none of those patients were on ventilators. Today, which is about 6 weeks later, we have 202 COVID inpatients. About 25 of those are on ventilators, and more than that, probably about 30 are on either high-flow oxygen or BiPAP, and that's really the next step. The next step is you get on a ventilator if you don't get better during that phase. And so we have seen a tremendous surge. It has overwhelmed our staff, our physicians, and really those, we've talked about heroes, and they were recognized as heroes early in the days, but y'all, they're still here and fighting, and it's hard on them. They see people suffering and dying. We had a 23-year-old patient die this week in our hospital, unvaccinated. It's tragic, and we just don't feel like the world understands what's really happening behind our walls in the hospital. I would say that I'm vaccinated. I'm happy to be vaccinated. Got it as soon as my age group and my opportunity came open. My entire family is vaccinated. I encourage everyone I know to get vaccinated. We know it works because we know that 80 to 90% of the patients in our hospital are unvaccinated. So that tells you in and of itself that vaccinations work. And we know that masking works. We've been wearing masks at Mobile Infirmary and through all our hospitals since March of 2020 because masking works. Our employees haven't been sickened by COVID patients in the hospital. When they've gotten sick with COVID, it's because they've been out in the community and maybe not masking like they should be. But we know we have our own little experiment within the hospital, and so we know vaccinations work, and we know that masking works. Unfortunately, we're having to close some of our services that we normally offer to the community that are important for our community. Like our geriatric psych program, we have to move those nurses to the COVID unit. We're suffering staffing shortages. We've had to postpone our inpatient elective surgeries. People need surgery, and we want to be here for our community. But we just don't have the resources to take care of 200 COVID inpatients, and then the balance of the rest of the patients still need help. And our ERs are full of patients that need help, not just with COVID, but for heart attacks and strokes and accidents and all the things that happen to people that bring them to the hospital. Very much appreciate you being here. I'll reiterate what Mark said. Please pray for our staff and our physicians. They have been the leaders in this pandemic since March of 2020, and they really deserve all the recognition and all the prayers you could give. Thank you.
Good morning. My name is Ben Hansen, and I'm the president for North Baldwin Infirmary. And like Susan Boudreau at Mobile Infirmary, we have also had a drastic change in our census at North Baldwin over the past 6 weeks. North Baldwin Infirmary is more of a community hospital. So we only operate 58 beds in our community hospital there in Bay Minette. And we generally run an average census of about 20 to 24 patients at a time. Well, now we're running at about 50 patients, average census on each day. We have 25 med-surg beds, and all of them are full. Majority of them are for COVID patients. Our ICU, we have a 5-bed ICU. They're all full. Every patient in our ICU is on a ventilator. Our emergency department, we have 15 bays. Out of those 15 bays, this past weekend, 11 of them are housing patients with COVID. This puts a tremendous stress on our hospital and our staff, especially for a hospital our size that wants to serve our community and our surrounding areas. People have asked, well, are you doing elective surgeries? No, not now, because we're having to use the space to house patients. And so when they look to see that we have beds available maybe in one area or another, well, can't we do outpatient surgeries? They don't have to stay in the hospital. Well, we would, but our nurses are being needed in other areas. Now our recovery room nurses are doing monoclonal antibody infusions. So it's taking all of our staff just basically to support the patients in our community with the COVID response. And they want to, and their heart and they're passionate, in their heart, they're very passionate about the care for their community. So right now we are currently 24 patients in our hospital that are COVID positive. So basically 50% of my hospital is positive for COVID, for inpatient. That's a big percentage for our size of a hospital. Out of those 24 patients that have COVID, 7 of them are ventilated. Out of those 7, all of them are unvaccinated. And for all of our COVID patients, approximately 90 to 92% are unvaccinated. So the vaccines work. I am personally vaccinated. My entire family is vaccinated. And we're glad to be a part of the process to get this whole COVID pandemic behind us. So as Susan Boudreau mentioned as well, please continue to pray for our staff. They are so passionate about the care they're giving. They want to be there. They don't want to go home, but they are tired. But none of them are giving up. And we appreciate them, and we thank our nurses, and we thank all of our physicians. And some of our physicians have even stepped up, and that usually do not work in the hospital, they just work in their offices. They have come in over the weekend to help provide care for our patients in our community in Bay Minette. So we thank all of our physicians as well for supporting us and helping us to get past this current spike in COVID cases in our hospital and our community. So thank you so much for being here today. We appreciate your time.
Good morning, everyone. Thank you for being here this morning. I want to start with just to reiterate what Mr. Nick said, and Susan and Ben. I think this part of this morning is really about our staff and our leadership and our physicians and what they're doing every day. When you walk the floors and you see the pain in their face and the anguish and the compassion they have for these patients, it's very, very touching, and they are giving it all every day. But the community needs to realize the significance of the pandemic we're in right now and the surge we're in right now. I will tell you, in January, I thought we could never exceed what we did last January. We went through that surge. We're running now about 70% above that. We are at 90 patients at Thomas Hospital this morning. We have a 164-bed hospital for med-surg, and we've got 90 COVID patients in there right now. 20 of those have been in the ER, rotating through the ER, trying to get beds for a week. I mean, we've kept 20 to 25 patients in our emergency department trying to manage, a number of those on vents, a number of those ICU. We have 14 patients on ventilators this morning. 98% of those are unvaccinated. 92% of our inpatients are unvaccinated. We have suspended elective cases at the hospital. So if you have an elective orthopedic case or a case you've been waiting for, those have been suspended. So our staff can rally together to support each other and care for these patients. And once again, our ERs are full. So if you're trying to provide access of care for anything outside COVID, it gets to be very, very challenging for our staff. So the message today is get vaccinated, protect yourself, protect your family. I'm vaccinated. My family's vaccinated. Took me a while to get my kids there, but they got there. I'm very proud of them for doing that. And it's about community responsibility, protecting ourselves and protecting each other. And let's continue to do that. And once again, thank you all for being here. And I want to recognize our staff, our team, and caregivers across this area deserve the recognition. So thank you all.
Yesterday afternoon, I had an opportunity to have a conversation with Mark Nix, and Mark explained the situational crisis that the infirmary and all of our healthcare providers are in the city of Mobile right now. So having understood where they are with the patient load, Mark was asking, he said, Mayor, what do you think that we can do as a community to make sure that all of our healthcare providers feel appreciated? So in a period of about 16 hours of thinking about that, I know there's a lot that can be done. And this morning in the staff meeting, we were kicking around things that we need to do as a community to make sure that we do the things that we can do. I want to regress just for a minute and say this, as citizens, we just expect if something's wrong with us, we're going to go to the doctor and be taken care of, or we're going to go to the hospital and be admitted, and there will be a physician or a nurse or somebody there to take care of you. And what you've heard today is that's not going to happen the way it's happened in the past. And unless we do something differently, it's going to just get worse. And so you have seen political leaders, you've seen sports figures, you've seen heroes and other endeavors tell people to please wear a mask, to get vaccinated. Well, we're in a pandemic crisis, but we're also in a crisis now with our healthcare workers, is the way I heard what these ladies and gentlemen have told us. So, if you recall in the parking lot, the prayer vigils, the candlelight services, the things. Well, just in a matter of a few minutes of staff meeting this morning, what we realize is that we too, in city government, we have people that go underappreciated, and sometimes it's our policemen. But you know what happens when a policeman walks in a restaurant? There's somebody almost invariably that will buy their meal or go up and tell them thank you for their service. And I would challenge Mobilians, if you see somebody in scrubs or a white coat, or that you know that they are a healthcare provider and involved in that system, please go tell them thank you. Buy their meal. And if they're a personal friend, have you thought about because of the stress on it and because of the hours they're working, that maybe something as simple as cutting their grass, and that may sound corny to you, but it's not, because when you don't feel like you're appreciated, anything that somebody does for you is appreciated. Run the carpool for them. These are just a couple of the ideas that we had. I know that from the mayor's position that we're going to call for a day of prayer for all of our healthcare workers and for our community. That'll be forthcoming. But it's not just a day of prayer. I would suggest that we continue until we know that we have turned the curve on this, that we continue to pray for those who have to make a personal decision about wearing a mask, about getting vaccinated, but also for the healthcare providers. Because God's still in the business of answering prayers. So I would just say in conclusion, this is extremely stressful time for those who we're counting on to take care of us. And so please take this to heart. Wear your mask. And I know that one of the media is getting ready to ask me, well, Mayor, why don't you just make everybody wear a mask? Well, I cannot make everybody wear a mask, okay? I cannot do that. It's a personal decision whether you're going to do that. And I can tell everybody coming into one of the city-owned buildings that they have to wear a mask, and we're doing that, okay? So we're going to do the things, and we're going to continue to get the message out. But when it comes to vaccines, in the past, all we need to do was wash our hands and social distance and wear a mask. And today we know that that's less important probably than getting the vaccine. And so for those who have had a loved one in the hospital that did not think they were going to get it and that were not vaccinated, we hope that you will help spread this word. And so I'm grateful that Mark reached out to me. Actually, we were following up this morning on another phone call, and he said, Mayor, we're going to have a 10 o'clock press conference this morning and tell everybody really where we are. And I actually said, Mark, I think I have some things I'd like to say to the community about supporting y'all. And again, I'm here at the infirmary, but it is all of our healthcare providers in every part of this community. So this I know is that when Mobilians understand that there's a crisis, a hurricane, and the aftermath of a hurricane, Mobilians will unite. And that's where we are right now today. We're in a healthcare crisis, and we need your help, and we need you to unite. So I encourage you to do that, and I thank you very much. Appreciate it.
Okay, let's go ahead and, if y'all have some questions. Do y'all have any questions for our leaders that are here today? Okay, which leader?
I've got a question about the whole system.
Okay, okay.
Are employees in Infirmary Health required to get vaccinated, and if not, why?
Thank you. Let me respond to that. No, they are not required to do that now. We actually had an incentive-based program. We rewarded all of our employees that made the decision to help us and help keep everyone at work by giving a $100 incentive for everybody that was vaccinated. We gave out over $550,000 in the just last week to those people that that came in and validated they given the vaccine. We will be reconsidering that. We're at about, I think the Alabama state average is somewhere around 37-38% vaccinated. We're over 65% vaccinated here among our employees. So we're well ahead of the curve, double what everyone else is doing. Part of that's through the incentive. When the emergency use authorization is lifted, which is fully expected to happen within the next 2 weeks, you're going to see employers and others start to mandate vaccinations. Some of that's already been announced by some healthcare workers, and we'll be considering that. Our plea is that with the number of people that are out and the number of employees realizing how stressful it is that we have 160 team members out, that they will make that decision for themselves and help us get our numbers up to where we can be another leader in the community in a different way. And I would say this one thing about the vaccines is, I know it's very political and I don't really understand everyone's politics about it, and it doesn't really matter. But if we looked at this disease, like if we looked at polio and smallpox, the way that people look at COVID-19, we'd be pushing around a lot of our children in wheelchairs, because we send them to school to get vaccinations for measles, for smallpox, for all the things that we've historically tried to eradicate from our planet and done a pretty good job with it. But for some reason, this one just doesn't hit home. But you look at the number of deaths, not only in our community, but across the state, the nation, and worldwide, it just doesn't make sense that people won't want to put political things in front of your own safety of your family and things. So I want you to consider that the vaccine, one day we're going to look back at this and say, what was this generation thinking? Why didn't they do what our forefathers did and eradicate polio or eradicate smallpox for developed countries? So,
I don't know who would want to take this, but you guys, all of the folks who spoke today painted a very grim picture about how you guys are dealing with this latest surge. If this continues, I mean, you guys are going to run out of beds, you guys are going to run out of staff to be able to handle patients. I mean, if that continues, could more people die if people don't take this more seriously?
well, absolutely. The challenge is that and we were a pretty full hospital and a healthcare system before COVID, and we've had to, we now have more employees out. We've had more employees retire. They don't like the working conditions, the stress of it. They're worried about their own safety. And this is a nursing shortage across the nation. This is a crisis. And it's not only that, but your response times, as I mentioned earlier, from EMS, they're sitting in our hospital bays and ERs with patients in them. We're having a hard time when we're converting 75% of our ER beds to holding patients. So when people start coming in for what they always came in for, whether it's an automobile accident, whether it's a cardiac event, or whether it's a neurological event or a stroke or whatever that is, our resources are now being strained, and at least half of those resources are being dedicated to something that roughly 85% of the people representing that 50% of care are unvaccinated. So we really need to stress this, is that it's not just COVID. It's every other service line, and now, as you've heard, just as they have in Huntsville and they have in Birmingham, we are suspending elective surgeries for at least a month to try to get our get our resources back together and take those caregivers and nurses out of those critical areas and put them in areas to take care of COVID patients. So yes, it has definitely has the risk of doing that. And this is not just us, and we're here to thank healthcare workers across our community and everywhere. But we were on a call yesterday with the Alabama Hospital Association and the Southwest Council of Hospitals, which includes pretty much hospitals all the way up to Washington County, Mobile, Baldwin County. Every single person is in this same position. And there was one hospital, a rural hospital up in Washington County, that the closest bed they could find for a patient that had a GI bleed but with COVID, they transferred that patient to Florida. And we're going to start seeing there is no capacity along the Gulf Coast. This is true. I talked to people in New Orleans, Ochsner is full. I talked to people at Singing River and Ocean Springs, they are full. I talked to people at Sacred Heart, they are full. So when we get full everywhere, there is no place to go, and we're going to be trying to find places that we can ship patients to other areas outside of where they can be around their families. So it's a very detrimental time and a stressful time on all of our workers. Yes, sir.
I know there's been some reports in Mississippi about bringing in, contacting the federal government to come in and provide assistance, temporary medical facilities being set up, and whether it's parking lots or outside tents and stuff along those lines. How close are you moving? Is this area close to moving in that direction? Is that under consideration?
Well, I think I speak on behalf of hospitals in Mobile because we've talked to all of them. We would prefer the resources be given to someone that has been treating this. We kind of know what we're doing now. We're 15 months into this. I'm afraid if we come up with a federal government and they place a tent in the parking lot, where are they going to get the resources that we can't get? Everyone in this nation, every hospital system is looking for nurses. Unless they have an inventory of nurses somewhere that we're unaware of, the most likely thing that's going to happen is they're going to be trying to get our nurses from our hospitals in our community and within our system to go work these emergency room tents. So we're supportive of help, but what we really need is some places other than inpatients, like the therapies that we're talking, the antibody therapies. You can give those in non-hospital settings. So we would love the assistance from the health department or from the feds to start doing these antibody therapies, which keep people from being hospitalized. If we can keep them out of hospital, I think we can handle it. So yes, we need resources, but I'm concerned about the level of care that you get when we start establishing tents in parking lots, and where do you get the employees? And again, I think talking to all the hospital systems in our area and nearby, they would prefer the resources be directed to us where we're already experienced in working on this.
Is Infirmary Health among the higher hospitals with COVID hospitalization?
It's the highest in the state of Alabama right now. This is the third time it's happened. It happened in July, it happened in January, February, surge, and it's true again. I think UAB is somewhere around half the population the Mobile Infirmary has of COVID units. And we saw this before. The surge has typically started, the last 3 times, it has started along the Gulf Coast, and then it has moved inland. And so we've been talking to the governor's office, we've been talking to the state health officer. They're watching what happens here because of the crisis and the number of beds and personnel, but they're fully expecting this to happen in Birmingham and then on up into Huntsville. And it's going to happen that way across the state. As Susan said, we thought we were over the worst of it. We had North Baldwin and Thomas, I think, got down to actually either 0 or 1 or 2 patients, and 8 here. And now we're higher at every location than we ever have been.
Urgent cares are busy, hospitals are busy. Where should people go to get tested? I mean, are you guys planning to open up any? I know it was always said from the beginning 15 months ago that, treatment's the same whether they need to go to whether they have to, or if they're severe enough, they have to go to the hospital, obviously, to get treatment. But are you guys planning to open any drive-through testing sites for folks so that they know that they are positive to stay out of the community? Right.
That's not the plan right now because of we may have to end up doing that, but we're so stressed on other resources. Testing is readily available. It's available across the community. Urgent cares, there's all kinds of places you can go get tested. But my challenge would be, what are you going to do if you go get tested? You can go get vaccinated and avoid getting COVID or have a high probability of it, or you can go get tested for it. And personally, I don't think that, and our healthcare professionals would tell you this, I'm not sure we can mask our way out of this. But we do know that vaccinations work. So we can't vaccinate our way out of this. But if you're wearing a mask and just hoping that you don't take it off at the wrong time, around the wrong family member, at the wrong dinner table, and that you don't get it, the odds are you're going to get it. It is in our community and it's prevalent. And it's running about 40% of the people that are getting tested have COVID. So if you talk to 4 people or 10 people, 4 of those 10 people you're talking to in a conversation have COVID, whether they know it or not. And there's still some asymptomatic cases out there. So testing is not the answer, and we've been down that road and everything. Masking is a great answer for a little bit of time, but vaccination is the ultimate answer for us to get beyond this.
I want to ask about the employees. When
Yes.
they go into quarantine, do they have to use personal time?
No, well, we have a variety of things on that. No, we are actually allowing them, they have some earned time off that they have themselves. So we will use a couple of days of their earned time off to do that, and then they will go onto a workers' comp plan if they, because if they've contracted the virus while they're working with us, and we can identify where that was. We have a little bit of different situation that we have to deal with if they haven't been working here and they go off on a family reunion somewhere and they come back and they come into their system, then we have to look at that at a case-by-case basis. Where did they contract the disease? Was it through working with us, or was it personal choice, personal decision?
I asked because somebody said that majority of the employees contracted the virus outside the community, in the community.
I think that's true in most places because we're mandated masks. So I think that's probably true that most everybody did, and most everybody does, because if you come in a city building or you come into any hospital in this town, you're going to have a mask on.
Piggyback off what he said, we got at least one caller, but I think maybe 2, claiming that Mobile Infirmary has COVID positive staff working. Is that true? Is that something that
That is not true.
That would not be true.
No. As soon as anyone finds out that we test someone, we send them home with a quarantine.
Okay, y'all.
Okay? Thank you all very much. We appreciate the attention to it. And please thank our healthcare workers when you see them. And thank the mayor for coming out and taking his time this morning as well. We appreciate your coverage.
Thank y'all so much. Thank you.